After investigating a couple, we find out where is the cause. And the common problems found in the couple are practically divided as 40% in the female partner, 40% in the male partner, and 20% we don't find any cause in both the partners. Common causes in females include polycystic ovaries, which is basically a hormonal disturbance where menses may be irregular, tubal factor, where tubes are blocked because of some infection or operation. Endometriosis is another very common cause where there is the endometrial lining grows inside the abdomen in an abnormal way, and it disturbs the function of tubes, ovaries, and affects fertility. In the male partner, common causes sperm counts can be low or absolutely zero, or there may be some other problems which are related to sex, timing, effort, and other things. In all these cases, the first line of treatment remains ovulation induction with injections or medicines, and maybe we can add intrauterine insemination taken from husband semen. We take out active sperms and inject in the uterus of the wife at the time of ovulation. The success rates with this technique are around 15 to 20% in 3 to 4 cycles. In case the sperm counts are zero, sperm from a healthy donor given by a sperm bank which is recognized by the government can also be given to the couple. IVF, in vitro fertilization, or commonly called test tube baby, is a technology where wife is given injections to hyperstimulate, which means instead of one egg which is formed every month, we target to make about 8 to 10 eggs which are taken out when they are mature with the help of ultrasound guided needle aspiration, and then these are fertilized in the laboratory with husband's sperm and then transferred back in the uterus, what we call embryo transfer. If I can explain these techniques in a little better way, you can see this picture. This is an enlarged ovary containing about 1, 2, 3, 4 on this side and 4, 5 eggs on left side. There is a needle which goes directly in the ovary. There is no cut, no bleeding, and then these eggs are aspirated and they come in the tube. Sperms are collected from husband either through ejaculation, or they can be taken directly from testes if the tubes are blocked, or if 2 weak sperms are there. Then in the laboratory, egg and sperm is fertilized, which is called IVF, or in case sperms are very weak, one single sperm is injected inside the egg, which is called intracytoplasmic sperm injection, or ICSI. Then these fertilized eggs are monitored in labs, which are kept in incubators in a very in such an atmosphere which is congenial to their development, in incubators at 37 degrees, and they need a special gaseous atmosphere. A very sterile, highly sterile room is required, and lot of precautions have to be taken. The culture media are specially designed for embryonic growth, and then they are monitored in the lab for they can be grown up to 5 days, but most commonly on day 2 this kind of picture is there, where they divide and form 4 cells. This is called pre-embryo, and then this is transferred by a very simple procedure called embryo transfer, and 1 or 2 or maximum 3 embryos are transferred in the uterus, and pregnancy test is done after 15 days. Woman requires to take a lot of injections to develop these multiple follicles, and even after embryo transfer, they require hormonal support to support these embryos. The success rate with such a procedure is around 40%, 50%. The maximum failures occur at the step of embryo transfer. After transferring the embryo, it depends on nature, or it depends on the uterus, whether uterus and embryo, they have an equation, whether they click to each other or not, and that determines the success. The common indications for this procedure is block tube, which is an absolute indication where nothing can be done without IVF. But all other indications where other treatments have failed, like 6 cycles of IUI have failed, or multiple cycles of ovulation induction have failed, or without any reason it's just not happening. Endometriosis is an indication where IVF should be done early. In all those cases, IVF gives excellent results. Again, the most important determinant of success of IVF is woman's age. The egg or the seed perhaps is the most important thing in which an embryo develops and success happens.